And Newport News is about 49% African American. And what we noticed is that there were disparities, kind of like what as you, Ben, and Bernard were speaking earlier about who's getting certain types of care. And we just started to get into we were looking at obviously like what's causing this. And in many instances it was footwear, but on the backside, once these people get their ulcers and wounds, we found that a lot of doctors, instead of being patient to work through these patients, were just going right to the amputation. In Hampton Roads, I'm known for two things: the bomb and saving people's lives in terms of the limbs. About 20 years ago, as a younger doctor, Calvin and I, my partner, were in our office seeing patients about 11:30. One of my assistants comes in, says you have a call from a patient that's at the VA hospital. And at the time, we were doing some contracting at the VA hospital, and one of my patients called me from a gurney. He was outside the operating room. They had everybody lined up. He just happened to be like maybe number 8 in line, but he was going to get his leg amputated. I asked him if he could put his surgeon on the phone with me, and it was somebody that I knew. So we went to the hospital, and I saw the situation. I asked the surgeon, and we couldn't do anything. Matter of fact, we were just laughing about this just a couple of days ago because what we did then we couldn't probably do now, and that is I switched places with that surgeon and took his patient into the operating room, like
Mhm.
without any paperwork being done. Long
Right.
story short, uh, he just had a really bad abscess, diabetic patient, got drained the wound of the pus, treated him with antibiotics, debridements, grafting, and this, that, and the other.
Which interspace or which area was it? Just to kind of have a little bit more detail about it, if you remember.
Sure, sure. So this particular gentleman, basically diabetic, not well controlled, but at the same time, he had a wound that expanded from the middle of the foot plantarly, coming up up around the medial malleolus, just above the ankle.
It was tracking up the interosseous lumbricals up the flexors.
That's correct.
Yeah.
That's correct. So took him into the operating room, opened this area up even above the area of the wound, like 100 cc's of pus pouring out of this guy's foot. But this is the clincher. We got him healed probably in about maybe 4 or 5 months of doing wound care
Right.
with him. And guess what he did once he was healed? We didn't know this, that he was a car dealership. He said, "What kind of cars do you want?" And at the time, we were into pickup trucks. This is Hampton Road.
Right.
Gentleman delivers two brand new Dodge pickup trucks to
Wow.
our
Holy
office.
smokes.
Wow.
You changed his life but you lose that first leg, and then you've got an increased chance of potentially losing that second leg, even if you have the prosthesis. And then the comorbidity mortality rate probably doubles it, maybe even more. Also, I want to say we've got GLP-1s now. So I think we should all be very astute at not quoting statistics from 2016. We got to be relevant to today, what's happening with the sugar control. But
Right.
I think we can all know that these rates are going to go up for sure.
Absolutely. And to your point, Ben, not to mention too many stats, but usually once they receive that first BKA, within 5 years, they're probably getting another. And now we've got all this pressure on the heart. These people are having silent heart attacks and dying.